Welcome to the Secrets of College Planning. I'm your host, Anthony Uva, and today we're going to get some insight into sports therapy. My guest today is Geoff Stankus. He is the Doctor of Physical Therapy and with Robert Wood Barnabas Health Sports Physical Therapy Center out of Princeton, New Jersey. And welcome to the show.
Thank you for having me.
Yeah, so usually I start my guests where they went to college. So where'd you go to school?
Undergrad, I actually went to Rutgers, New Brunswick. Loved it there, did a victory lap, 5th year, and then I went to University of Pittsburgh for my doctorate in physical therapy, which at the time I think was number 2 in the country, and now I think it's number 1 or tied for number 1.
Great. So let's just go back in time. Let's go into high school. When did it all start for you of thinking about going to college? Was it freshman year of high school, senior year? When did it all begin?
I kind of always knew that I wanted to go into physical therapy or something related to sports after being athletic my whole life. So there was no question I was going to college. I just didn't quite understand what grad school entailed after college. But I knew I was going to college, and then once I was in college, I think my sophomore year, I started to understand all the nuances of preparing for grad school, which I had to go to get my doctorate.
So now, was Rutgers the only school that you applied to, or did your mom and dad get involved where you checked out a whole bunch of schools first?
I checked out everywhere and anywhere, and I was actually opposed to Rutgers because I grew up in Hamilton. I went to Nottingham, right over across the road, and I did not want to go anywhere near home, did not want to be here. Applied a bunch of places, and then after going places, things like that, I actually went to Arcadia University outside of Philly for a year because they had what was called a 3+3, where you could do 3 years undergrad and then move right into 3 years of physical therapy school.
Gotcha.
So it shaved the year off my overall time. It was just a small school. It was not as diverse as I hoped I would have found in college. So after talking to my dad convinced me, he's like, hey, right down the road. So begrudgingly, I went to Rutgers, and I had an amazing experience. Do not regret the decision to go in there. Actually wish I probably went there my freshman year. The older I get, the more I realize my parents were right. Hate to say it, but they were.
So now you're at Rutgers University, you're doing physical therapy there. What's it like at Rutgers?
I was in the exercise science and physiology department, so it's just kind of at the time, it was like a hodgepodge. They didn't really have like a pre-med or pre-physical therapy program like some other colleges do.
Okay.
So this was the best major that prepared me the prereqs for grad school. So a lot of bio, a lot of physics, a lot of chemistry, a lot of math, all those prereqs that I needed to apply to graduate school was in the major, and it was the closest thing to physical therapy or sports that they had at the time. Now I think that program has morphed a little bit, and they have a more linear physical therapy path, because I had to take a bunch of stuff too, because they also had some other majors that they were lumping in it. So there were certain courses that were not like applicable for physical therapy. So it was 1 or 2 extra classes at the time.
So now, when does one start to think, oh, I can go and continue my education at University of Pittsburgh, or was there other schools that were involved?
So for me, I love to make spreadsheets and be very analytical. So I wound up, after my debacle with undergrad, said, hey, I'm going to do this a little differently for grad school. So I literally searched and found USA News ranks all the physical therapy programs. And that's actually one of the most comprehensive rankings anywhere. So I just went through and I picked the top 10 programs. And I kind of went with, how they're set up. So every program teaches the same exact material, but how they choose to teach it is very different. Some programs are very didactic, where you're in the classroom and you're doing everything in a controlled environment with an instructor. Other ones rely heavily on clinical experience. So you go out into an actual physical therapy clinic as an intern with direct supervision from a clinical instructor, which would be myself now, working hands-on with patients. And it's very different. You can wind up having a totally different caseload in one clinic versus the other. And then some of them also now offer residency programs where you can graduate and then go into a residency for sports, for orthopedics, for neuro, geriatrics. There's a whole bunch of clinical specialists, board clinical specialists, residency programs you can go right into. So I put that all in, and I kind of just saw what was good for me, what wasn't. I realized after going to Rutgers, I really like a big school. I went to Pittsburgh a couple times to visit my aunt, and Pittsburgh was a great city. So I just applied, top 10. And then I applied to both Rutgers North and South, so Newark and Camden. Had PT programs, I applied there. And then I applied to one safety school, Thomas Jefferson. I got into, Thomas Jefferson was actually the first one I heard back from, and they denied me.
Oh, wow.
And I was like, well, there goes my career. I'm done. I'm not getting it anywhere. And then I proceeded to get accepted in the top 10 plus Rutgers. So I think it was just they either had all the spots full, or they're like, he's above what would come, so we're not even going to bother offering him a spot because he's not going to show up.
Wow.
So that's how I wound up at University of Pittsburgh. And after I graduated, I loved to ski. I loved to rock climb. So I pushed really hard to get out to Colorado, and I spent many years out in Colorado before actually cycling back to New Jersey. I came back in, I think, 2014 or 15. And then eventually migrated back down here, a whopping 10 minutes from where I grew up. So
now, did you do physical therapy out in Colorado as well?
Yes. I actually worked and managed a clinic that was associated with the Steedman Clinic, which is where all the Olympic skiers go for their knee surgeries.
Oh, wow.
So very, very prestigious place. It was a great environment to work in, learned a ton, worked with great surgeons, great therapists. Was set to be there, but family issues came up, and I felt it was better for me to be in the same time zone and close by. So had an opportunity in North Jersey to come back and kind of become a partner in a clinic. Came there, wasn't a good fit. Eventually wound up joining Robert Wood Johnson Barnabas Health, and I couldn't be happier.
So now you're at Robert Wood Johnson Barnabas Health. What's the position? What do you actually do there? What do people come there for?
So this is where it kind of gets murky. We, as a physical therapist, I could treat anybody. Now over the years I've become very specialized, and I deal more with orthopedics. So physical therapy rehabilitation really breaks down into two main settings. You have neuromuscular, which would be stroke, brain injury, spinal cord, and you have orthopedic. Orthopedic is very, very broad. All that basically means is there's a problem with your bones. That's it. You can have anyone from hip replacement, knee replacement, rotator cuff, ACLs, sprains, broken bones, all that gamut. And you go anywhere from, as young as you feel comfortable treating. I've treated 8-year-olds and younger, all the way up to, you could treat somebody that's 93. Being a sports clinic, how it winds up happening is we tend to not get people that have elective surgery. So like a hip replacement or a knee replacement would be something elective, years of arthritis, pain, lack of mobility. You're like, I'm done. I want to have a high quality of life. You go for a hip knee replacement. Typically that's not what we get in the sports clinic side. Typically we'll get people that, like a soccer player who just blew out her ACL, a pitcher with a rotator cuff, something like that, where there was a sudden injury, right, and they had to have surgery, or a sprain or something along those lines. It doesn't always have to be surgery that brings them to us at a sports physical therapy center. Right. It's usually something immediate that happened that changed how they move.
Now, does Robert Wood Johnson Barnabas Health, do they do the surgery and then you guys take care of after surgery?
So they could. You can see any doctor you want to for anything. The law is very clear that doctor can't send you to a physical therapy practice because conflict of interest. If they own the practice, they might get a kickback. So down here, we're kind of, there's not a lot of Robert Wood Johnson surgeons down here. If you're closer up to Somerset, or actually if you're up in Barnabas, up in Livingston, they have a lot of orthopedic sports surgeons up there that will do rotator cuffs, shoulders, things like that. Actually, one of the Barnabas doctors did my father-in-law's shoulder after a ski accident. Wow. So, and did a great job. I didn't think his shoulder would move the way it could, and Dr. Cooper did an amazing job on my father-in-law. So, but he didn't actually wind up going to see a Barnabas physical therapist. He just went to see somebody that he knew and saw in the past. So, gotcha. You can see whoever, but there are a lot of good surgeons in the Robert Wood Johnson Barnabas system.
And then, so after the surgery, they come to you?
Yes. Sometimes we get them beforehand, like if they know they're getting an ACL done. One of the biggest indicators for a successful ACL surgery and recovery is that they have a good, what's called a VMO. That's part of your quad muscle. What happens is if you get an injury, you get swelling in the knee joint, and that causes distension. That distension inhibits muscle contraction. Well, then that shuts it off, the muscle becomes flaccid, and then you have a lot more complications getting it to kick back on afterwards, after the surgery, because the surgery itself is going to create additional swelling. Injury swelling, surgery swelling, quad's not going to work. So sometimes a good surgeon will actually refer them for what's called Prehab. They come in before the surgery, we work on getting their knee stronger, their motion better, getting some of their swelling down to set them up for the best success and quickest return to sport after the surgery.
So now, do you find one particular sport more where they're coming in and going, oh geez, you know, that kind of stuff, compared to other sports?
Everyone asks that question, and the answer is no. What we do see is the athletes, the parents, the coaches who take a vested interest in injury prevention. So doing things to work on strength, control, basically finding asymmetries before competition and working on addressing the asymmetries before the competition significantly reduces the risk of having a major injury. You can never, the only way you can prevent an injury is not move. Well, you get out there, someone does a cheap shot, or you're playing on a field and there's a divot and you step in it, anything's possible. But the better your control is, the better your proprioception, the better your body awareness, and the lack of asymmetries prior to competition significantly reduces the chance of an injury. Gotcha. So you see those kids that take that interest, those parents, those coaches, great. There's some people that just, I don't want to say don't care, because I don't think anyone ever wants anyone to get hurt, but just aren't aware that there's stuff that you can be doing before an event. Besides just the stretching, the warming up. There should be weekly routines of certain things you go through to just decrease that chance. And I wish everybody knew that, because it's so much easier to treat an injury before it limits you. And people think, oh no, I have this asymmetry, I can't play. Absolutely not. I believe in, if we identify it, we can modify your activity if need be, but we can work on that asymmetry pre-season, even during season, to keep you safe and keep you on the field, and prevent you from having a major injury and tearing something or being out for a while.
Now, does Robert Wood Johnson, Barnabas Health, do they go to the high schools and do seminars on these type of things?
Yes and no. We're trying, but sometimes school boards and things like that, they're the gatekeepers. And there's a lot that we're trying to work on. We have to educate the school boards first to let us have access to the students. Which I totally understand. The idea is you're trying to keep the kids as safe as possible, so you have to vet everyone coming in. But you can't offer a competitive advantage if you have one system in and not another. So there are nuances, which I totally understand. But I think the biggest thing we're starting to see is a lot of coaches are getting certified in different training techniques, and because they are getting certified, their awareness is becoming higher, and they're actively seeking out injury prevention and discussing and things like that. Ideally, I would love it if every school board, every school got us in, let us screen. But now we can get into the whole, they're cutting programs, adding another layer of something.
Now, do you find a lot of parents that come to you before any injuries and just to find out more?
Yes. So since, I've been down here in Princeton now probably about 3.5 years, 4 years, I'm definitely starting to see parents reaching back out to me. I might have treated one of their children, and they have another kid that's starting along that competitive path, and they're like, hey, do you mind if so-and-so comes in and you just kind of screen them, look at them? I know you worked with my daughter and got her back, and I just want to make sure that doesn't happen with my son, or things like that. So I definitely, if you provide quality care, patients appreciate it, parents appreciate it, coaches appreciate it, and then they start to use me more as a resource than as a stigma or therapy, which I love. The more I can educate somebody, the better it is, because they're with them 24/7. They're with us a couple times a week. So I have a lot of knowledge on biomechanics and kinesiology and injury prevention, but you don't need to have all of that. You just need to have what's pertinent to you.
Right.
So if I can convey that to you any way possible, makes my job easier.
Now, you talked about a few times screening. What goes into a screening? What is a screening for a student athlete that comes to you?
It really depends on the sport. So, for example, if you're talking about, say, a tennis player or baseball player or golfer, those are what we call like rotational sports. So we have to look at the whole kinetic chain. The only way you can move is you have to exert force on something, so the ground. So we have to see how they move all the way through their spine, their back, their hips, their knees, their ankle. And if there's a deficit somewhere along the way, you're going to compensate somewhere else. It's a summation movement. Yeah. So if you're missing a few at your knee, missing a few at your hip, that might not be a problem. But then if we look at your back and we say your back's doing 120% of what it should be, that's going to lead to potential overuse. Doesn't mean you're going to have a back injury, but if it's doing more than it should, that's not good.
Now, these are exercises that they're doing at the facility?
So we can wind up basically, we look at it, so going back to, like, let's say a golfer, right? If they're moving too much from their back and not enough somewhere else, we're going to go in and try to figure out why they're not moving well elsewhere. And what we'd wind up doing is we would address the mobility issue. So if something's tight or a joint's stiff, we'll give specific exercises or correctives to address that. And then we'll go up to their back. And what I like to do, and a lot of my colleagues do, is say it's moving too much, so we have to teach them control and stability. So they might be doing a certain set of exercises for their back to prevent a back injury, but at the same time they're doing other corrective exercises to improve mobility and control at another joint, just to optimize how they move.
Now, do you see a lot of concussions these days as well?
We don't, in this clinic particular, see a ton of concussions. That was actually something we were talking about a while ago, is in the area, we're trying to figure out who is seeing them neurologically for concussions, because a concussion is a very complex injury. A lot of people misunderstand what is going on. They don't see a physical, you see a broken arm.
Right.
It's broken. But if you can't see what's going on in the brain, there's other ways you measure it, through cognition, through visual ocular tracking, their ability to change directions, external stimulus. There are things we can do that really help to kind of get them moving in the right direction. Again, no pun intended, but we can actually assess it and see how well they are doing.
Yeah.
And there doesn't seem to be a very good pathway in the area. I think concussions are still very misunderstood, and probably, we went through this thing where they were underdiagnosed to then they were now overdiagnosed and everyone had a concussion. And I think people got a little bitter about that, and they started to kind of pull back from wanting to let their kids be diagnosed with a concussion, because they thought that they wouldn't be in school, where now the research is saying, like, actually, no, we're going to get them in school sooner. We're going to get them doing things sooner than we were initially with the concussion, because now we better understand what's going on neurovascularly. So we're working on it.
Now, as someone that's gone through the physical therapy environment, do you find one field more than another field that a lot of people tend to go into? Like for yourself as a physical therapist?
So going back to thinking grad school and some of the people I knew, there were some people that came in day one, and day one we're all asking, what do you want to do? What do you want to do? And it was very naive to think like, hey, this is what I'm going to do the rest of my life. In the 10 plus years I've been in the field, I've been in so many different environments and settings that I never could foresee myself being in, walking in day one of grad school. I tended to like the outpatient, the sports, they tend to be higher level, but I remember one of my clinicals was a spinal cord injury unit in Pittsburgh. And actually I think it was one of the, if I wasn't doing sports, I'd want to do spinal cord, which I never would have thought of before I started. It's sad. It's very traumatic. Usually for a spinal cord injury, something serious happens.
Sure.
And you get a lot of young people. You get people in their 20s, 30s, motorcycle accident. They went diving into a pool and broke their neck.
Football accident.
Football accidents, yes.
Sure.
All kinds of things like that. And you have this very young population that has so much of their life ahead, and you're trying everything you possibly can to just get them functioning, enjoying life again. And I think there's been so much carryover from soldiers coming back that the technology of saying like, hey, they're still young and they want to do outdoors things. I remember working with somebody getting a wheelchair, a power wheelchair, so they could go hunting. Not something I ever knew about before, but it was just a very different experience, and very rewarding every day, very draining, but very rewarding. But it's something I never knew existed until I had that clinical opportunity.
So before the show started, you gave me a little tidbit of a secret, being that it's secret of college planning. You said something about if you became a physical therapist and had student loans, what actually happened?
So, from how it winds up working, if you wind up going into the National Health Service, NHS, they will place you in underserved areas. So a lot of times it is like a Camden or Trenton or something. Potentially. Like I know people that wound up getting placed by the Grand Canyon on a Native American reservation. And they worked there for, I believe it's 10 years. You can please double check me on it. But after 10 years, all the government loans are forgiven. So you make your minimal payment for 10 years. You don't pay a dime more. Wow. And then you hit that mark and you're gone. So if you have a combination of private loans and government loans, you keep just the minimum payment on the government loans. You try to pay down those private loans. And if you can stick with it for 10 years, there's definitely forgiveness. There are other programs for nonprofits. So if you work for a nonprofit, it's a different kind of requirement. And I don't know how much they forgive, but they will forgive some of the federal funded student loans. So I always tell kids when they ask where they're going, they're always looking at that dollar sign, which I totally understand. And I never want to put someone in a situation where you're saying, hey, you're burdened with hundreds of thousands of dollars of student loan debt to just get a job. But you will learn the same material because you have to take a national board. So every program has to be certified that they teach the same material. And there's different programs will teach it a different way. So you find one that teaches the way you learn. Yeah. And try and keep in mind if you wind up working somewhere like a nonprofit or for National Health Services, you will get a lot of that loan, or you could get a lot of those loans forgiven if you qualify for federal funded loans.
Now, what is the actual difference between a physical therapist and actually becoming an actual doctor, an MD?
So I went to undergrad for 4 years, did a victory lap, but then I would be 4 and then 3, so I'd be 7 years of undergrad. MD, you would wind up having, you start 4 years, same thing, and then you go into medical school. So you go through their whole residency program and everything like that as well.
Tests are a little bit different as well?
So a lot of times what we do, especially in the orthopedic side, we have a lot of hands-on manual tests that are very sensitive and specific, and we learn those musculoskeletal, so bone, joint related stuff. An MD, depending where they practice, has to know a lot more tests, so they don't have the same, typically they don't get the same hands-on tests that we do. Mm-hmm. So we can actually be more precise at diagnosing or rolling in or rolling out certain orthopedic injuries that some MDs do not Not all of them. Some of them learn and go through residencies and can learn different things. But typically speaking, if you went to your PCP, your general doctor, they wouldn't have the same hands-on testing as we do, and they might order x-rays, MRIs, where there's what's called clinical prediction rules. So if you're positive for 4 out of 5 things or 3 out of 4 things, there's like a 98% likelihood that you have a fracture. So we can say that, and okay, we save someone from having an x-ray. They go and cast them, and that's that. No extra radiation exposure or anything.
Well, we're coming to the end of our show. And usually I ask my guests, what advice do you want to give to the kids out there that, A, want to get into physical therapy, B, have an injury and want to come and see you? What advice do you want to give to everyone that's listening?
Know that you can be in physical therapy and still play, still practice, still train. A lot of people are initially, until they come into us, very resistive of coming because they think that they're not going to be able to play, their season's done. It's the exact polar opposite. The sooner you get in, actually, the better and easier. So if it starts to hurt, don't wait. Just try to talk to your parents or talk to your doctor and try to come in and see us. You won't regret it. As for people going into physical therapy school, I say simply try to get as much volunteer and exposure in different types of clinics as possible. Try to keep an open mind. There are a lot of avenues. There are a lot of programs, and you can wind up finding one that winds up working best for the way you learn and where it winds up being located geographically. There's just hundreds of them throughout the country, so don't make up your mind until you come in, see, talk. Ask your physical therapist their questions of how they wound up where they wound up. You'll be interested in some of the stories you find.
Good. Well, thank you very much for coming on the show.
My pleasure.
Yeah. So you've been watching The Secrets of College Planning. I'm your host, Anthony Uva. Until next time.